Good afternoon and welcome once again. I'm going to be very, very brief myself this afternoon and just really announce the sort of running order. Deputy Salisbury is going to build on the conversation that we had last, whatever day of the week it was, Monday or Friday? No, Friday, I suppose, in relation to, excuse me, the what will happen at midnight from midnight on Saturday. She will then be followed by Paul Whitfield, the Chief Executive. We'll then have an update from Dr. Brink, of course, together with any supporting rationale for some of the decisions that have been taken. And finally, a bit of an update from the Head of Law Enforcement, Rory Hardy, on some of the enforcement-related activity that's been going on. So enough from me, straight over to Heidi.
Thanks, Kevin. As Dr. Brink made clear on Monday, we're currently in a good place. The curve has been squashed, and that means we're ready to begin our exit strategy. Our approach to that exit strategy is threefold. Firstly, testing, contact tracing and quarantine. Secondly, a phased easing of restrictions. And if necessary, thirdly, adaptive triggering. Nikki will continue to keep everyone up to date on our approach to testing over the coming weeks, and I would like to focus on the changes that have been approved by the Committee of Health and Social Care yesterday and that will come into effect from Saturday. These represent what we hope will be just the beginning of a gradual easing of restrictions before we end lockdown. Saturday isn't about a big bang change. The core message remains stay at home. We've been very successful in flattening the curve by reducing contact between members of different households, and this focus must remain. What we're doing instead is looking at areas which can resume some level of activity without presenting undue risks to the community. This means that we have carefully considered which businesses have the potential to operate in accordance with public health advice and won't disproportionately increase risk to the bailiwick. So with effect from Saturday, the additional businesses able to operate under specific conditions will be gardening, building and other trades with no household contact, building wholesale and supply, vehicle servicing, maintenance and repairs, which includes cars, bikes and marine, property sales, rentals and business transactions. There are specific requirements being placed on those businesses as to how many people they'll be able to have on site and how they'll be expected to arrange their premises, taking into account social distancing and hygiene requirements. Additionally, the new guidance also outlines changes in relation to the number of employees allowed to carry out non-essential work on office premises, subject to meeting, again, social distancing and hygiene requirements. Any business falling within these categories and that wishes to operate from the 25th of April must register that they wish to do so by notifying Environmental Health via www.gov.gg/COVID-19 business notification. That's COVID-19 business notification, all one word. This isn't about process, it's about protection for businesses, for employees and the community. The practical steps which businesses will need to take have been designed to be as simple, straightforward and automated as possible. Where businesses experience difficulties, and I make no apologies for this, is if they seek to circumvent the restrictions in place or if they seek to pressurise staff to work at this time. Guidance on reporting breaches will be on the coronavirus website by the end of play today, and people can call the number 717 118, which is manned by our team, not the police, or they can use COVID-19 inquiries at gov.gg. As I said at the start, the phased easing of restrictions is just one of three elements to our exit strategy. As we've spoken about previously, the third aspect is adaptive triggering. Should we find that the number of cases gives us cause for concern for a variety of reasons, such as the level of community seeding, then we will not hesitate to tighten up the restrictions again. However, hopefully that won't be necessary and we can continue on a smooth path to the eventual end of lockdown. Finally, I'd like to cover off a couple of other areas. Firstly, the commercial and household green waste facilities will be opened up from the beginning of next week, and further details are going to be provided on that. And we'll also be issuing guidance on which recreational activities can be undertaken. There have been a lot of questions about this and various suggestions as to how some forms of recreation could be undertaken. So we think it's worth putting out some more detailed guidance on that front. So just like for businesses, our decisions will be based on evidence and take into account the wider risk to the community. That's it.
Great. Thank you very much, Heidi. So, Chief Executive.
Yes, thank you. Sometimes some of the feedback we've had is that we can repeat some of the information provided, but to a certain respect we don't make apology for that, because it's to try and emphasise and give clarity on these particular and specific changes as we move along. We now consider the opportunities presented by the most recent guidelines. Our primary message to you remains the same. Please continue to observe the guidance set out when we entered our first phase of lockdown. Even with these relaxation, our success depends on us continuing to do this. If you operate a business that complies with the revised public health directions and you wish to operate from Saturday the 25th of April, then please complete the online form gov.gg/coronavirus. The form and accompanying guidelines will be online following this media briefing today. As Deputy Soulsby says, this is a notification process rather than a permit or a registration process, and it will guide you through a set of questions aimed to help you understand whether your circumstances mean you can safely operate. Importantly, we are not waiting to issue with permits because we do not want to hold back those who are able to return to work while we process paperwork. But whilst the primary objective is to support business being able to function, if they are found to be returning to work when they shouldn't or simply cannot adhere to the guidelines, then as noted by Dr. Brink, in terms of protecting the health of the community and the gains made against managing our response to the virus so far, we have no hesitation in closing down those businesses. Any reports of business operating outside the public health direction should be reported via gov.gg coronavirus, or, as Deputy Soulsby has made note, the non-clinical helpline, which is 717 118. A purposely resourced team from the Office of Environmental Health will be making regular and routine checks that businesses are complying with the rules, and the compliance and any complaints will be investigated and acted upon. We will be making sure that we can support those businesses by facilitating the management of waste where we can manage the requirements to social distance. Details of waste management will be made available on the website later this afternoon. If you operate a business that is not able to open, then there is financial support available for you. If you're an individual who needs financial support, then again this is available to you. All details and guidance continue to be made available on our website. The virtual call centre is up and running, as of yesterday, covering 6 priority lines for the Hardship Fund, Income Support, Business Support, Education, Revenue Services and COVID-19 non-clinical helpline. From our starting point of only a handful of operators, we now have 60 call operators, and they're now working to answer these calls. More can be added in this area if we need to. Our phased transition is dependent on us all continuing in the positive way we have been. Public Health will be constantly monitoring the situation, and any sign that making these adjustments is adversely affecting the current positive, then we will review. Given the spirit in which the community has adopted and supported the strategy so far, we are not anticipating issues with non-compliance. We are grateful for your support, and it is combined community effort that will allow us to move safely through these different phases together and come through to the other side as quickly as possible.
Thank you very much. Thank you, Paul. Dr. Brink.
Thank you. So we've now done over 2,600 tests on Ireland, so really, really encouraging. We've got 243 positives now, so we're only seeing a handful of positives, so 1 or 2 each day. So again, that's really encouraging as well. We've got 134 people that have recovered from infection. So we're very pleased with that. I think from our perspective, we also got questions as to whether we could actually publish the number of active cases. So we publish our graph. So we've had further queries whether we could actually include those active cases in our graph. So from today, those will appear in our graph as well. So any information that you feel that we present that you'd like to see in a different format, we're more than happy to look at that if at all possible. So pleased with the progress on that, but as I've said before, is no reason to be complacent. We need to keep our hard-fought gains. I think they have come at a cost to all of us, and we need to be really aware that we keep those gains. So from our perspective, when we look at easing out of lockdown, we always said our move from lockdown would be a combination of test, quarantine, and contact trace, together with our adaptive triggering, together with our easing out. As we ease out of lockdown, we haven't considered it sector by sector. We've considered it from a public health perspective. So what can we safely do from a public health perspective? So let's help those businesses, individuals to operate. So I think that's really clear from that point of view, and something that we want to move forward with. But linked to that, we'd also like to highlight that we remain concerned that people might not be coming forward for other medical treatment. So we'd really like to emphasize the fact that during this time, our other medical services are open. So people with lumps and bumps that they're concerned about, please do consult your doctor with regard to that. We also would like to put a special plea with regard to vaccination. So we've seen a slight decline in people bringing their children forward for vaccination. Now, what we don't want to be doing is battling another infectious disease at the same time as battling this infectious disease. So we want to keep our polio vaccination rates up. We want to keep our measles vaccination rates, our mumps, and so on. Really important. We have safe and effective vaccines for these infectious diseases. Let's use them. The health visitors are operating a safe service. We have protocols in place. It really is the right thing to do to bring your children forward for their immunisations. So that's a plea from that point of view, because as I said, we don't want to be dealing with more than one infectious disease within our community at a time. And just finally from me, a personal thanks. Rosie, the midwife, sent me this lovely lanyard, and I really do appreciate it, and she asked me to wear it to the press briefing today. So thank you very much, Midwife Rosie. It was really a lovely gesture to receive this. So,
okay, thank you very much, Nikki. So, Head of Law Enforcement, Rory Hardy.
Thank you, Chief Minister. Good afternoon. Law enforcement position at the current time. Our levels of resources are really good. We're operating with a sickness level of less than 5%, which is far lower than we'd anticipated during this time. And our staff all have the appropriate access to their personal protective equipment. From our perspective, I would like to thank the community for the cooperation they have shown to our staff during this time. That said, I think as the conditions continue, despite some of the easing, there are some hard yards ahead for some members of our community, and we really do realise this, and we're here to work with you. There have been an increase in calls for service in terms of households who are experiencing difficulties. Some domestic abuse has been reported, but we are here to work with you to take those reports and resolve those issues. So please don't hesitate if you need to make a call. Mental health has become an issue in the community, and we're working with our partners to work with individuals who do need those calls for service. We are here to help in that area too. We would encourage third-party reporting. If you see things or hear things, or you know of things that might merit someone from an official capacity to check out, whether that be child protection, domestic abuse, anything that may concern you, please make that call. Don't sit on it. One of our trained officers or a member of staff from social services will respond. Our borders team continue to work in partnership at the airport and the harbour to manage passenger movements in and out of the island. We have been having an increased visibility, also working with local boat owners to try and discourage unnecessary private boat use, and we're very grateful for the support that we've received from that section of the community. Our Customs and Excise colleagues are also working tirelessly to clear all freight supplies into the bailiwick as efficiently and effectively as possible, and this has included the importation of vital medical supplies. The wider criminal justice system is working, And under these very unique circumstances, I would like to express my sincere thanks to all those in that area of business. This includes the courts, the judiciary, the prosecuting authorities, the prison and probation service, who are all seeking to support these processes in difficult times. Certain work has been suspended, but there is a need to run criminal courts, deal with remand hearings, and generally ensure that the criminal justice process continues. At these briefings, I have touched upon traffic-related issues previously. In the main, road users are being responsible. However, there are still some motorists who are placing themselves and others at risk by driving, for example, at excessive speeds. Guernsey Police are proactively undertaking speed detection work across the island, and we are prosecuting offenders. On Monday, 2 cases appeared before our magistrates' court. Both were cases that were detected during the lockdown, and these individuals were dealt with for speeding. One driver received a 7-month disqualification and a fine of £400. The second, a 2-month disqualification and a fine of £350. Other cases are pending court. Please don't take risks on the roads. Keep your speeds down and drive responsibly. A good news story is that road traffic collisions are lower. Between the 25th of March and the 17th of April, we only recorded 14 road traffic collisions, whereas in a similar time last year, we recorded 64. This is a good news story because it prevents additional patients going into the hospital for emergency treatment, which is really important. Law enforcement has reported 5 individuals for COVID-related breaches, and we are pending legal advice on these files. And we have also issued a number of verbal warnings and final warnings to members of the public to seek compliance with the COVID restrictions. Law enforcement will continue to support the Director of Public Health in ensuring that compliance is maintained until these restrictions are lifted. Thank you.
Great. Thank you very much, Rory. Okay, so we'll open up to questions. Who'd like to start first?
I'm happy to go first.
Yes.
It's actually a question related, Laura Clayton, Bailiwick Express.
Thanks, Laura.
For the benefit of the media critics watching on Facebook. It's actually a question relating to the Rainy Day Fund, Deputy St Pierre, and obviously you spoke about this in detail the other day with regards to effectively financing everything that comes next. But having spoken to a few people, some people don't know much about the Rainy Day Fund. So are you able to tell us how much money is in it at the moment? How long has it taken us to build up that reserve fund effectively? And when did the island last dip into its savings in such a way? Okay. I mean, I've been back in the island since 2008, and I don't believe it has been in that time.
Yeah, well, it's a very, very good question. The Rainy Day Fund, it's a sort of colloquial term that was used by those who started to put aside funds, I think, probably in the 90s, early 90s maybe, might even have been possibly the late 80s. And it built up over a considerable period of time up until 2009, which was when it was accessed in order to support the transition to the 010 corporate tax strategy. It used to be called the contingency reserve at that stage, and it was in 2008-9 it was split into 2, a sort of general contingency reserve and a contingency reserve to support the tax strategy. So it was split literally 50-50 down the middle. And at that stage, not all of the contingency reserve that was anticipated to be used for supporting the tax strategy was actually used. From memory, around about 96 million was used between 2009 and 2014. After 2014, there's been no access required to those reserves, and in fact in 2017 and 2018 we were able to put in about an additional 18 million because of the surpluses that we had over those couple of years. In that period, we also renamed it, and it became known as the Core Investment Reserve. So it was if you like, the term I've used is our sovereign wealth fund. So it was really the Bailiwick's family savings account, really, where we tucked it away with no intention of accessing it to fund either day-to-day services or indeed capital projects. It was there for the unpredictable. So really, this event definitely ticks the box as something that was unpredictable, and therefore provides a reason to be able to access it, obviously subject to the states giving that approval, possibly later this week, if we get that far in terms of being able to present and debate a policy letter on the subject. So, we at the end of last year we had about £195 million in the core investment reserve. That will have gone down a little bit in value because of the move in markets since the 1st of January. But that's the sort of level that we're talking about. So roughly, at the moment, we're thinking that we're looking for states' approval to access about roughly half, 100 million. So if you compare that back to what happened in 2009 to 14, it took us nearly 5 years to spend 100 million, and we think that we will effectively burn through half the reserve in a matter of months, which just gives you a real sense of the scale of what we are facing here in terms of an economic crisis and an impact on public finances. You know, the impact of shutting down a good chunk of the economy for a number of weeks has that kind of consequence, as big as and as significant as 5 years of transition in the corporate tax strategy. So hopefully that gives some kind of sense of the scale of what we're dealing with.
Take to rebuild our savings account?
At this stage, absolutely no idea. I mean, it's far too early. That will depend on our whole economic recovery. It will depend on the performance of economies around us and how deep and long this recession is going to be for the global economy. There are so many variables in that at this stage, it's just not possible to say. So it's a fair question, but one that I'm afraid I'm just not in a position to answer. Thank you. Next question. Oh, sorry.
Hi, Juliet Puto from the Guernsey Press.
Juliet.
I was interested to find out a bit more about our on-island testing and what sort of resilience there is, as in how many people are trained to use the equipment, how much kit have we got, do we have some backup parts if any of them happen to go wrong, what's going on?
Okay, so thank you, that's a great question. It's something that, unsurprisingly, I've put a lot of thought into. So we've got two direct viral detection methodologies. The one is our assay, or what we call our in-house assay, which is an assay that enables us to process fairly large numbers, so we can do runs of 46 to 48 at a time. And that targets 2 regions of the viral genome, so really a robust assay, so we can actually look at the amplification of 2 different parts of the virus to validate that result. So resilient with regard to its accuracy, so we're pleased with that. The second assay that we procured for on-island is something called a CEFID assay. So at the end of the 2009 swine flu pandemic, we made a decision, because at that time we were totally dependent on UK testing, and we realized that that was an issue. So we bought a platform called the CEFID platform, and the reason why we selected that particular manufacturer is that it has a whole respiratory array. So we knew that they had an interest in respiratory technology. So we've procured some individual tests for that particular platform. Now, that's a one-off testing. It's rapid. It takes about 20 minutes. But that's really useful, for example, if we have a really critically ill patient and we've already set up our run for the day, or one of our runs for the day, we can then go back and do a one-off testing. So we've got 2 different molecular technologies. We have also got a regular delivery of swabs and the reagents that we require coming on to the island, and we're able to test up to about 200 a day. That really is pushing our systems, and at the moment, because the level of respiratory disease in the community has gone down, the number of tests we're doing is going down as well. But that's not because we can't test, it's because we're not being asked to test. So I think that's positive. So looking at the kit and the resilience of the kit is, obviously we are dependent on 2 pieces of kit, but having 2 different technologies, and we purposely did this to give us some give in the system, has given us some protection of an immediate piece of equipment failure. So I think that's important for that. We've also, on top of that, started looking at the role of antibody testing. Now, I think I've spoken to you before about the lateral flow antibody tests, the finger prick ones, and how it's quite difficult. You're doing finger pricks, and I'd really like to record the data, get a good idea of what's going island-wide. Is over the next couple of weeks, we should get our first 96-well antibody delivery, and we're going to then look at using that in particular clinical situations. So sometimes what happens is that someone becomes ill, they actually lose the virus and they're negative, but they're still quite unwell, and they'd really like to know what they had, and so under those circumstances we can check for antibodies. So they're under another group of people we're interested in is for staff members. The other group that we're interested in is for contacts of known positives, and then eventually looking at a prevalence population, our whole prevalence study in our whole population, but that's down the line. So we have quite a robust testing strategy for a small jurisdiction, and I think it's the credit of the pathology services that they've really taken this on board, and we are still running 2 to 3 assays, 2 to 3 runs 2 to 3 runs a day, and in fact I think I looked at the last run about 8 or 9 last night. So we really are testing in real time, and we're still testing on Saturday and Sunday as well. So does that answer your question with all?
No, that's fantastic about the kit. In terms of people who can actually use the kit, I know you did have to do some training with them.
Yes.
Is it a very small team who can specifically use these bits of specialist kits, or is it quite a lot of staff can use it?
Yeah. So we've now trained up 6 members of staff. So we started off with just 2 that could perform the assays, went on to 3, and we've now got 6 members of staff, and that was a critical part of our planning, was this technology shouldn't be limited to a few people who could do it. So we now have 6 members of staff that are competent to do the assay. So again, it's just improved our resilience.
And just one slight follow-up question. You mentioned about reagents. I know there has been a struggle, or there has in the past been a struggle to get hold of this. Has it become easier as things have eased down, or have we just been using less? Or?
No, we haven't been using less, we've been using more, in fact. We've our supply chain has become more secure. Now, obviously, we're in uncertain times at the moment, so things can change, and we're always really mindful and careful about what we do. But at the moment, we're getting the reagents in that we need.
It just goes back to what we said on Monday, and the procurement team's been doing an excellent job making sure things are coming through on time and when they need it. But it is difficult. It can be just in time in many ways, because, you know, these things are rationed around the world, but they've been doing an excellent job of sourcing where we can get stock from and not relying on the NHS supply chain.
Yeah, so it's just like we're not, in relation to the management of this whole public health crisis, we're not complacent. We're not complacent about, we talked about PPE, we're not complacent about PPE supplies, we're not complacent about supplies of swabs or reagents, but it is something that is being carefully managed, and as Heidi said, the procurement team has done an absolutely fantastic job, and I think but it's something that we are very much keeping an eye on. The other thing that I just wanted to add on to your comment there, Nikki, was in relation to the scale of what we're talking about. To be able to do up to 200 tests a day would be the equivalent, in a population terms, of the UK doing 200,000 tests a day. Bearing in mind that they've promised to build up to 100,000 tests a day by the end of this month, and they are struggling. I think they're about 14,000 at the moment. So they are per capita, per head of population, performing a mere fraction of what we are now able to do as a result of the work of public health and pathology and all the work in gearing up. So I think, again, it just gives a sense of scale of where we are and why we are so well positioned in terms of being able to retain and stay in the contained phase.
And we hear a lot saying, you should compare us with the UK. No, we don't always compare us with the UK, but we often get asked, well, the UK are doing this and what are we doing? But as Nikki showed and explained on Monday, and as deputies who had a presentation yesterday were shown, our testing rates are far higher than Germany, which people are lauding quite a lot at the moment.
Yep.
I think the other thing is, we made the decision from the beginning is that we'd run a 7-day service. This virus isn't a Monday to Friday virus, and we said we'd do a 7-day service because the testing is so integrally linked to our contact tracing and quarantine that if we wanted to be effective in that, we had to have a 7-day testing service. And we've done that from the moment we got our off-island testing. We've run a 7-day service.
Great. Next question.
Hi, Oscar Pearson from BBC Guernsey. Thank you for the update and for taking my question. Just to talk about what we've learned today, I feel like we're learning more about how you're going to ease the restrictions on businesses from the weekend, so gardeners, builders, vehicle maintenance, property sales. Clearly this is about low risk work, and you're thinking how we can get small businesses which have limited interaction with the public back operating, and it could give a boost to our economy. I wonder, you might hear from other businesses which you haven't identified as being allowed back in operation yet, looking at what you're announcing and thinking that they should be allowed to work, to operate too. So could you tell us a bit about the criteria by which you're deciding which businesses can go back and can be back operating?
I think it's probably, we can do it combined. It's between Nikki and myself, because clearly this is advice taken and on board from Nikki about what was considered low risk enough that we could do now. Now, there might be other businesses that think, well, we can do this as well, but we didn't want to go out there, big bang, bring in a whole load of new businesses at once. We need to make sure that we could manage it from both in terms of the services, supporting it behind there, and also so public health could then ascertain, if we bought everything at once and we saw an outbreak somewhere, it'd be really difficult then to identify it and know that we could control it. So really it was in many ways to support public health, so we could ease off gradually, and we know the controls, we know how things are working, and then phase in other businesses. We're not talking necessarily about this lasting for a month. It might be next week we can say, okay, these other businesses as well. It's really very much based on what's the evidence showing us. Is this working? Yes, we can now afford to just ease off again. So this will be a really difficult phase for people. It's more complicated because people are expected to do stuff. Businesses have to understand what they need to do, but it's really just to say, please bear with us. This is something that, if everything works, we're not seeing community seeding, we're not seeing a huge increase of cases in ICU in the hospital, then this will continue to happen on a gradual basis.
Okay. Do you want to add to that, and then Paul?
I think just that we wanted to present the population with a sustainable solution. I think the most damaging thing is where you do something and say, oopsie, and we pull back, and you're in a perpetual state of backwards and forwards. I think if we present something that's sustainable, that we introduce something based on public health principles, and then we move to the next step. And it's absolutely our intention is to keep moving forward. And I think our advantage is we have a solid evidence base behind us, and I know I always talk about evidence, but we've got that solid evidence base. We know what's going on in our community, so it's to do that stepwise, sustainable fashion, and not having to pull back, because I think pulling back is damaging for a number of reasons.
Yeah,
Could I just clarify something with you then, if that's all right? So those who are, it's a policy decision, so those who are allowed to go back to work.
It's a direction, yes.
From the weekend, yeah. It might not make them key workers. Maybe you could clarify that. But does it mean that their children could go back to school, or will they have to be continuing to be distance learning?
At the moment, it's just essential workers and other groups that are allowed to have their children at school. So that won't change at the moment. And that's something that we'll have to look at in the future. Clearly, it's as we get more and more people being able to go back to work, that will be the tension we'll have in terms of what we do with the schools, which Nikki's very aware of. That it's going to be difficult just to say, might everybody go back to work if they haven't got people that the kids can go back to school. So I don't know if Nikki wants.
Well, Paul wanted to come in.
Yeah, I just want to provide a little bit of perspective and clarity. Clearly, what the guidelines don't do is identify each and every individual business. It would be virtually impossible to do that. And what it does do, the guidelines provide very clear themes of work that we would expect to see could take the opportunity to open up. But I think you have to go back to first principle with whether those businesses can operate to the guidelines and those that have been put out by public health. And that is the starting point. But I think as a community, these already actually include a lot of businesses. The numbers are quite high as part of our real economy, and so therefore you will see an increase in traffic. You will see an increase of businesses opening under these current guidelines. And if people are struggling to identify whether they fit or not, of course, as previously referred to, the business support team are there to enable businesses to identify, but also support and help them in how they might open up and adhere to the guidelines.
Can I just add, we're not saying all businesses can open and everybody who's going back. We're actually limiting the number of people that can go back into that business on site. So the maximum that people will be able to have in an office, say, is 5. That will be the maximum. Same works for trade and of building supplies. The maximum of 5, and limiting the number of customers that can come in at the same time. So this isn't about all those businesses can now work as normal. It is really easing it in, because the key thing to this is all about the social distancing. That is what stops that seeding, making sure that people aren't interacting and minimising that as much as possible. You can't do that if you've got an office full of people. You've got to look at how you can spread people about so that they don't integrate and they can keep that distance. That's so important to keep the numbers down.
And I think it's just worth saying on the back of Heidi's comments, there will be a lot more information that's going to be published imminently. So again, if people need to go away and study that, and digest it, and before they start again deluging either helplines or inquiry emails coming in. We know people will have questions, but please look at the published information first is a plea. I think the other comment that arises out of your question, Oscar, in relation to this is a comment that we've made before, is that in many ways the easy decision and the easiest decision has been to go in. It didn't necessarily feel like that at the time, but with the benefit of hindsight, actually that's the easy decision because it affects everybody equally. Coming out is much harder because it's making these kind of judgments, and inevitably there will be, as again I hinted at it a few press conferences ago, there will be some observation from some parts of the community, some businesses about, well, hold on, my neighbour can go back but my business can't, why not? It feels unfair. And we're going to have some of that tension start to emerge within our community, and that's something again that we're going to have to manage as a community. We understand that. My plea for that would be, again, engage with government. If you think you've got a case and an argument as to why your business can be safely operated, then talk to government. Don't just go out and do it, but have the conversation through the helplines. And government will work with you, but please be patient, allow that dialogue to take place. There is an awful lot going on, and there are an awful lot of things to consider. So, but we do recognise this is a difficult phase. Another key point to emphasise, as Heidi has said, is what we have been quite clear we've been unable to do is to set out how long each phase will last. That will be entirely driven by what happens on the ground in terms of cases and the evidence that public health are able to pick up. So this could be a relatively short period or it could be a longer period. But again, it comes back to the more that our community is able to comply with the guidance and the regulations and the public health advice, then we won't lose the gains that Dr. Brink has talked about. We can bank those, and we'll be able to get the rest of the economy back as quicker rather than later. So it's a virtuous circle that we need everybody to be working to.
It is. It's that balance. I mean, we went in and locked down early. It made such a difference, but we don't want to lose all that just by opening the floodgates again too early. It's all about balance. It's not an exact science. It really is a judgment and trying to work out what works for the bailiwick. It's really, it is bear with us as we're trying to make sure we're doing the right thing based on the public health advice. It's all based on that and the evidence that we've got in front of us.
Paul, did you?
Yeah, just to add on, I think it's a good point that Deputy Salisbury makes about saying, well, it's not complete, even for those businesses necessarily, unless they are very small, a complete return to business as normal, because also at the same scale, we've got to look at the infrastructure that supports certain businesses. So opening up inner waste, opening up commercial green waste, we've also got to be able to handle to support that, and we've also got to apply the same public health guidelines in the way that we operate those support networks in our infrastructure. So this is really quite a holistic and balanced approach to bringing these on in a safe and controlled way.
Okay, next question. Yes, Rosie.
Rosie Alsop, Island FM. It's a question about the COVID-19 response appeal that you mentioned a couple of sessions ago and that Islanders have very generously donated to. Is it too early to say at the moment how those funds will be distributed? I understand they're for frontline healthcare workers and providing medical equipment.
Yeah, I don't think any decisions have been taken in relation to that. I mean, what I would say is the response has been very good over the first week or so in response to both the Social Investment Fund appeal and the COVID response appeal. We had over £100,000, I think about 60-ish to the first and the balance to the COVID response appeal. So, a huge thank you to everybody who has donated to either of those. And again, if anyone is interested, do go through the website and the appropriate links on that page. But in terms of decisions on how to use that, the appeal fund, I don't think any have been made. No, not at this stage. Rob.
Rob from the States Comms team, but this is a question on behalf of ITV, who are following the briefing remotely. Not prompted, I don't think, by the announcement today on which businesses are resuming activity, but probably more from conversations they've had with people in the tourism sector. They're asking if there's any way of giving any time frame or estimate of when cruise ships may be able to start coming back to the island.
I'm quite happy to pick that up.
Yep.
I think we made note on Monday's briefing. Our intention is to share the logic of our exit strategy from a public health point of view with Dr. Brink is working on with her team at the minute. And then also you hear us talk about that phased transition response to recovery. So how do you marry up, because they're very much in parallel, both the public health considerations and that of the recovery. So the sort of ends such as cruise ships are really in the final leg, phase 4, which is you're really getting to a state of normality. But phase 3 will start looking more in depth of how we can bring some of the tourism online, particularly at the minute. Part of the recovery planning is how, when we're able to do so, will we step up in that part of our economy. But I think we've really got to emphasise that the cruise ships, even as a business now, are planning for seasons henceforth, not the current season we're in.
Yeah, and I would have thought there aren't all that many cruise companies that are actually operating at the moment.
Yeah, I think the tourist sector, as much as anything else, whether it's cruise or non-cruise, is going to very much be impacted by what's happening outside the island, as opposed to what we may choose or want to do here. So we may get to a stage where we're much more comfortable in terms of our own management of coronavirus that actually we would be willing, but actually there won't be any custom there anyway. And I suspect that's quite likely with the cruise industry. I don't think they're going to be doing a great deal for a while anyway, even if we wanted to, and I suspect that's a little way off. Next question. Yes.
I've actually got a couple of tourism-related questions, so probably for Mr. Whitfield. We've been hearing, well, actually more on hospitality, we've been hearing from quite a few businesses across the spectrum who haven't yet received any funds from the States, having applied. But we're hearing that's quite a common theme from hotels, that they're waiting, and I presume all hotels are closed at the moment. So is there any message for hoteliers who are waiting for any funds to come through from the States? Is there a reason why the ones we've spoken to won't have had any funds yet?
Yes, I mean, actually processed and paid for over sort of 3.5 million in claims to date. And I haven't got the exact figures of today with me of where we are in current process. But we caught up by about 300 at the weekend. We also received another 150 on the weekend. So it's a moving feast. But I'm quite happy to bring some of those figures back to the next briefing as an update. But would just encourage, if you haven't already made that claim and it's now becoming more apparent that you need to do so, then please just get them into the business support unit. And I would emphasise some tolerance and patience. We've started off with probably half a dozen handlers, as I said in my update, and we have now got 60 call handlers working on business support, individual support and the hardship fund. So we are gearing up as per demand, but of course we've got to make sure we put call handlers that actually can work on those particular business cases. So yeah, please just encourage people to apply.
Okay, any others?
I did have another loosely related question to tourism, if that's all right, on a bit of a personal basis, because I've got holidays booked for this year, as I'm sure many other people have. And while it seems that Guernsey is in a great position, we do have to look at what's happening in the UK, and most off-island travel does involve flying to the UK if you're going further afield. So with regards to opening up our borders again, presumably we will have our hands tied by what's happening in the UK going forward for some considerable length of time.
Do you want me to answer?
Yes, please.
Yeah.
Thank you.
So from our perspective, we have to look at what's going on around us. So we've been very, very good at squashing the curve, and it's really a credit to the Guernsey population that we've been as effective as we have. But to open our borders and then just re-import cases back in makes absolutely no sense at all, because we've been through a lot of hardship to get where we are. If you look at our graphs that we publish on the attribution of cases, the attribution of travel cases is going right down, and most of our cases are now attributed to contact tracing, which is great, because these are cases that we're actively hunting. So to switch that curve around again, open our borders and have a whole lot more cases imported and start the whole cycle again wouldn't make any sense. So we need to be very, very cognizant of what is going on surrounding us. We know there's a lot going on in France, we know there's a lot going on in the UK, a lot going on in Spain, so a lot of the common destinations that we would normally go to, there's a lot of activity. So we'd really want to see declines in control in those jurisdictions before we said that free travel between those jurisdictions would be a good idea. And it's all about holding on to our hard-fought gains.
And I think just a reminder really of what we said at last week's briefing in relation to the phased approach, and we envisage phase 3 being largely free movement within the island, within our own island bubble, with the possible limitations on around some higher risk businesses or activities, but largely free movement, but retaining tight borders. So phase 4 is when we start to move to have opening up a more liberal approach on the borders, but again we've been unable to attribute any kind of timeline to that. So I'm afraid for your own holiday plans, and indeed most of ours, I think it's really... I
think no one's going to America anytime soon. But presumably in time there could be control. So if the UK were in a state of control, people could travel to the UK, people wanting to fly to New York for a weekend. That's not going to be happening anytime soon for anyone, is it?
I think we're in the stage of starting to sort of crystal ball. I think, as you've said, and as Dr. Brink has said, we have to be cognizant of what's going on in the jurisdictions around us and where people are travelling and what's going on in those places. So I think that will be clearly informing any future decisions. Julia?
We have been informed of at least one data breach where someone has got in touch to apply for a grant, and when they've received a response back from the state, it's included details of someone else's bank details and financial information. We don't know how widespread a problem this is or what happened. We're hoping you might be able to shed some light on what protections are in place and whether this has been a widespread problem.
Yeah, I wouldn't get into obviously the detail of a specific individual case, but I would confirm that we've been made aware that there has been a potential data breach, and of course, as usual, we're making the initial inquiries and reported the data breach. And again, it's not desirable, and we would apologise at any time if there was such a breach, but with an organisation that handles so much data as the States of Guernsey and now working remotely, as never before, we've got to be really cautious on how we're handling so much data, and they will be fully investigated as if we were operating normally.
I know we probably can't give specific numbers, but to the best of your knowledge, is we looking at this being just a couple of cases, or is it a widespread problem?
No, it's not a widespread problem.
But I think clearly the mishandling of anybody's data is always to be regretted, but equally, as Chief Exec has said, has to be very much subject to the data protection law and working obviously with the data protection commissioner in relation to those kind of cases. Rob.
The second one on behalf of ITV for Dr. Brink, and this is about whether there's evidence that coronavirus is seasonal, and if there's a second wave, would that come in the autumn or at a particular time of year?
Okay, so seasonality and coronaviruses. Some of you might know that there are a number of different types of coronaviruses. Some of the mild coronaviruses can cause the common cold, and we know there is a seasonality in relation to that. If we look at the particular coronavirus we're dealing with, so COVID-19, I don't think I would put a lot of confidence that we're going to have a seasonal variation. And the reason why I say that is if you look at what's going on in the southern hemisphere, you're seeing a lot of countries in their summer season, so New Zealand, Australia, places like that, seeing coronavirus activity. So I'd be cautious about relying on a seasonal variation. We might see some decline towards the summer months, but I don't think that per se, the seasonal variation per se, will be enough to bring this virus under control. Will we see a second wave? I think it's very possible that around the world you will see second waves of this virus. And I think the big challenge for all of us is to try and keep the virus under control until we have a vaccine available. And that's the absolute goal for all of us, is to look to an effective vaccine. We know 2 trials of vaccines are starting. Well, the one in Oxford has started. The Imperial College one is due to start imminently. There are various other global trials going on as well. So that's what we're waiting for. So yes, there's a potential for a second wave, which is why we can't let up with our containment measures.
Okay, next question. Any others? Yes?
Just one briefly, it's Oscar again from the BBC. One briefly for Mr Hardy, if I can. I think you mentioned that you've reported some individuals, I think you gave the figure 5, for COVID-related breaches. Obviously, without going into detail on any individual cases, what sort of COVID-related offences are being committed?
As a general description, it would be breaches of people getting together in inappropriate circumstances, like people not from the same household, which is clearly contrary to the restrictions that are in place.
Thank you. And are you relying on, you mentioned how important it is for third-party reporting. Are you relying on that to make those investigations?
To a degree, the third-party reporting request was primarily in the area of domestic abuse and issues of child protection and safeguarding. So it's encouraging third-party reporting in that area, those areas specifically. But of course, there are routes in which members of the public, if they have concerns, please do report, and those issues will be taken forward. Because of confidentiality and data protection, you may not get a reply back as to what's happened, because that may not be appropriate. But if you feel you know or see something that you would like the authorities to be aware of, report it, and please be assured that in conjunction with public health, if it's that kind of referral, we will follow those issues up.
It's helpful, thank you.
Any others? Yes, Julia.
Sorry to come back to you again. We've become aware of situations locally where some people are selling PPE, specifically masks, at a increased price, and often with not necessarily backed up medical claims. I mean, how much of a concern is profiteering with the PPE to Guernsey, and what can we do about it?
I mean, certainly in terms of the state's own procurement of PPE, they obviously won't be dealing with those kind of individuals or opportunities. I mean, that clearly is the role of the procurement team that have been working largely with off-island suppliers, albeit some of those have come through on-island contacts. I mean, ultimately, if others are seeking to acquire, if others in the community are seeking to acquire PPE and they're finding those kind of price hikes by those that are supplying it on island, I mean, that is clearly a matter for those individuals in seeking to deal with that transaction. And I don't see at this stage there being a role for government, because it's not actually impeding the work of the health team. Clearly, profiteering is not to be welcomed in any circumstance, and it has to be discouraged. But I don't see it as a role for intervention at this point. Heidi.
Yeah, no, I was Gavin just saying it's not at this point. We're doing well on the procurement front. We've got the masks, and we're expecting more deliveries. But if it comes to it, we'd say, well, you know, that we would hope that people would do the right thing if it comes to the point where we are really struggling, and just look to their consciences.
What I suggest is that we have a trading standards department, and if members of the public wanted to seek advice in the first instance, they could contact trading standards, and those are professionals in that area, and they can give some advice.
Yeah, particularly if something is purporting to be something that it may not be.
Absolutely.
Yeah.
Yep.
Next question. Yes, Laura.
Might be one for Mr Hardy, might be one for Deputy Soulsby actually. Mental health awareness, obviously during the lockdown, some people will be much more impacted than others. The state survey that's being done checking on people's well-being? Have you got any data on how people are coping during the lockdown? Has there been any evidence of a dip in?
Well, we do
well-being?
know, as Rory said, is that there are instances we have done, and we've got our mental health services trying to support people out in the community. There are lots of details on the coronavirus website. Guernsey Mind doing things from a distance. Lots of the third sector doing support for people who are getting anxious and low in that respect. In terms of the tool that you're talking about that's been used to see how people are feeling, I guess that information is something that Nick will have been fed to Nikki, and they'll get some background on how people are doing on that front.
I mean, mental health during lockdown is a serious concern for us, and I think, as I've said before, we've got the very narrow health protection issue of the virus, but we've got the broader health and well-being of the population, and we really need to focus on that as well. And from our perspective, it's putting people in contact who are struggling as well. So we've had quite a few people contact us and say, look, we're struggling, or people that we might be phoning for various reasons. And we've put some in contact, for example, with Healthy Minds, who are doing some distance support, which I think is really important. Guernsey Mind has also produced some really useful information. The Health Improvement Commission has produced some good data as well. So it's being very aware that this is a very difficult time for people. So people living with autism and so on, it can be an extremely difficult time. And we've been working also with the mental health services for some people who are finding it very difficult to have very confined periods confined periods at home, and what we've done is we've given letters to certain people to make sure that they're able to we're able to relax the rules a little for people under certain circumstances. This is not a huge number of letters we've given, but we also need to treat people as individuals, and we're really aware of that. So we want to make sure that we try and do the right thing by the population, but also realise that within the population they're individual people, and we need to focus on that. So we're trying to put people in contact with a variety of tools, but I think you're absolutely right to focus on mental health. I think it's particularly difficult in the circumstances that we're in.
And this is the discussions that we've been having over the last week, 2 weeks, talking about easing restrictions, getting that balance right. We're not going to keep lockdown for any longer than we absolutely have to, but we need to get that balance right between people's mental health, risk from the virus, and getting the economy running. And that's why it's not an easy job, but we're trying to do what best we can based on the evidence that we have and from the advice from Dr. Brink and her team.
And what we've been saying to people who are phoning us and saying, look, I'm really struggling, particularly with people who are living with autism, we've been saying, get in touch with your doctor, get them to get in touch with us, and let's see what we can do together to ease it for you in particular. And I think it's trying to combine that compassionate, people-focused approach with looking after the health of the population. There is sometimes tension between the two, but I do believe you can marry the two together and produce a good overall strategy.
Okay, thank you.
Great. Okay, any final question?
Do you have 30 seconds? Could I just end? It's Oscar from the Beep. Could I just end by just making sure I'm absolutely clear on what you said earlier, Deputy Salisbury and St Pierre, on those who are being permitted now from the weekend to go back to work, whether they're one of the 5 perhaps in the office who you talk about. They won't become key workers next week, for instance, and their children, therefore, won't be entitled to go in and use the school facilities. Is that right?
But
to be absolutely clear?
they could be considered low-risk workers, but not key essential workers, so no, they won't.
Okay, thank you.
Good, all right, well, thank you very much. We're due to meet again at 1 p.m. on Friday. I just want to finish with on a slightly lighter note. Because I haven't been going into the office for obvious reasons for the last couple of weeks, I haven't seen some of the correspondence that's been sent in, and actually I know that Deputy Salisbury had this as well. We both had an Easter card from, now I think if I got the pronunciation wrong, please forgive me, but I think it's Aishling, age 10, and it's an opportunity. I haven't got an address, so I can't write and say thank you, so hopefully saying thank you through this medium might get that message out, but really did appreciate the thought and the effort of that, and I'm sorry that it's taken a while to get to it, but as I say, it was only scanned to me yesterday. So thank you very much, and we'll see everybody again on Friday. Thank you.